Sipra, how are you?
I'm good. How are you doing today?
Doing very well, and we are so thrilled to be joined by Dr. Sipra Laddha, one of the founders of LunaJoy. That is correct? Yes.
Yep,
And we will get into all things LunaJoy. But first, how do we find you today? How are you doing?
I'm doing well.
Yeah, good, good. I have a background in public health, so I like to do the wellness checks when we kind of start these things.
Okay.
Know how your state of wellness is entering into this conversation is good.
Yes, my state of wellness is excellent. I'm excited to be here.
Awesome. Well, I'm so excited that you are here. Before we jump into LunaJoy, Sipra, I would love for you to just give a quick, thumbnail sketch of yourself, your
Mhm.
background, just to kind of orient our listeners to who we're talking to today.
Sure. So I'm Sipra Laddha. I'm a psychiatrist by training. I'm currently based out of Atlanta, Georgia, but lived most of my life in New York.
Mm,
I was born in India. I'm the daughter of immigrants. My
mhm.
parents were both physicians, came to this country when I was 4,
Wow.
and spent a lot of time in New York, and then came to Atlanta for residency. Focused on psychiatry and did a lot of work in reproductive psychiatry, so pregnant postpartum women,
Wow.
and then started LunaJoy in 2021. Just some other things about me. I'm a mom. I have 4 kiddos. I have a
Wow.
17-year-old twins, a 7-year-old, and a 5-year-old.
That's amazing. Did you go
Yeah,
to Emory in Atlanta? Is that
I
your?
did go, yeah,
Yeah.
for residency. Mhm.
That's amazing. So one immediate commonality we have is I have a first cousin who is a PhD
Okay.
psychologist, but her focus is exclusively on postpartum depression
Yep.
and working with postpartum moms.
Mhm.
She's out in California. She did all of her training out there, San Francisco area, that kind of stuff. So there we have a commonality there, which is such an important thing, right, for us to have a commonality on. So
Mhm.
can you tell us a little bit about LunaJoy? We know that it specifically focuses on women's mental health,
Yep.
but also I think the interesting thing is it's a dedicated platform for women's mental health, and I'm curious to, why you believed there was a need for a dedicated platform for women, and
Yep.
then also, talk a little bit about. I'm sure your approach is different from sort of traditional mental health services approaches, so
Mhm.
maybe you could give us a little insight there, Sepra.
Yeah, happy to give you a little insight. And I think it really starts a lot with my own personal and professional life.
Mhm.
So, like I mentioned, I'm a mom of 4, and I
Yeah.
had my twins during residency. So here I was, I
Wow.
was third, fourth year psychiatry resident, pregnant with twins, then postpartum with twins. During training, I was working in the Emory Reproductive Psychiatry Clinic, and a number of things came together for me at that time. A, I became a mom. B, I had my own journey, right, with postpartum anxiety, which was wild, I think, from a patient perspective, even though that's what I had been actively treating as a clinician. And then working as a clinician, I mean, my biggest takeaway is that it took women sometimes 6 to 9 months to get care, and that too in a
Yeah.
major metro
Yeah. It's so
center in
long.
the
Yeah.
South, right? And so in the community, and, what was happening outside of this resource was that women really weren't getting care. So I dealt with my own postpartum mental health issues, got myself into care, had a lot of resources. Even with the resources, it was really difficult. Able to move on from that first year postpartum, without too many battle scars from that experience. But again,
Thank goodness. But
um,
enough, I'm sure. Yeah. Yeah.
yeah,
Yeah.
and started my own private practice. I
Mm.
saw women in that practice for about 7 years, a lot of the same pregnancy, postpartum issues. Basically, what I was coming up against is that there was no preventative mental health care, there was
Mhm.
no proactive mental health care, and a lot of the conduit between women having babies and getting into mental health was broken, severed, like didn't even exist.
Right.
People who could figure out how to navigate the system and could pay a lot of money per hour to come and see me did, but that was like the
This
small
is a small percentage of people. Yeah.
percentage.
Yeah. Yeah. Yeah.
And so after, doing that for a number of years, I also worked in the health system at the same time and just learned a lot about systems and processes, right? And if we don't have systems and processes, we create these huge gaps in care without even recognizing it.
Sure.
And so in 2021, started LunaJoy with my co-founder, who's also a psychiatrist. She happens to also be my sister-in-law, but she had these 2 pandemic babies back to back, had,
Wow.
her own journey with postpartum depression.
Postpartum. Yeah. Sure.
Yeah. And so as a child and adolescent psychiatrist, we'd been practicing adjacently, known each other for many years. After she had her baby, she was like, we don't do this well at all. This is really
Right.
terrible,
Right.
what we put women through and what we subject women to. And she's seeing a lot of the pediatric mental health crisis. And even though she focused on the kids, it all comes from stressed family units, which often
Sure.
start with stressed moms.
Sure.
And so we just put our heads together and said, like, well, there has to be some kind of like
Better way here.
simple,
Yeah.
better solution here.
Sure.
And the simple, better solution, kind of like the lowest hanging fruit, is figure out how you work more closely with OBGYNs to automate these screens so that
Mhm.
we can't just add more responsibilities to their plate. How
Sure.
do we actually make it easier for them to take care of
Sure.
their patients? And how do we make sure that there's more mental health practitioners that understand
Right.
about the vulnerable life transitions and know that women, especially pregnant and postpartum women, have specific needs, and we can't
Right.
just give the same solution that we give to everyone to them and hope that it works well. So that's how we got started. That was really the impetus. It was just this problem that I kept on running into professionally, certainly personally, where we decided something needed to be different. And so
Yeah.
we kind of got to work.
Got to work right away. I
Yeah.
appreciate so much of what you just said, Sipra, too, about how, we create these gaps in care, to your point, right? Especially as it pertains to mental health.
Right.
And let's for a second talk about care coordination, or lack thereof care coordination,
Right.
right? Between primary care and mental health care.
Mhm.
And the other thing that really resonated with me with what you just said, aside from the fact that this is a deeply personal thing to you,
Mhm.
which, is not unoften the case with entrepreneurs. They
Right.
tend to attack things that are very personal to them.
Mhm.
What you said about the idea of, we have to make it easier for the OBGYN to participate in these screenings, assessments,
Mhm.
because we
Right.
can't add more to their workflow. We can't add more to their staff's workflow,
Right.
right? So the automation piece is so very important. That's exciting stuff. So
Mhm.
thank you for taking on this challenge. I am curious about one other personal aspect, if I might ask you. You
Sure.
trained as a physician.
Mhm.
I don't talk to a lot of physicians. I've talked to a few, but I don't talk to a
Yeah.
lot of physicians. But
Yeah.
one of the things I am curious about, Sipra, is how did your training as a physician, if in
Mhm.
any way, kind of prepare you or not prepare you
Yeah.
for an entrepreneurial journey?
Yeah. That's a really good question. And I think that there's so much there. I could spend an entire hour talking about this, but I think being a physician in a lot of ways prepared me very well, and then also in a lot of ways really hindered and made the entrepreneurial process, which is already so tough and difficult, even more tough. So I was chief resident, right? Your job as the chief resident is to manage
Yeah.
residents who are often working 60 to 80 hours a week, who are at
Hmm.
all different skill levels in difficult situations, and somehow make it be a positive, not only educational experience, but a work experience and a bonding experience and all of the things. And so I learned a lot that year just about, systems and processes and people, and how to align around vision and mission,
Mission.
and
Yep.
right. And get people who are truly very poorly compensated and often quite burnt out
Yeah.
to band
To be
together and have
motivated. Yeah.
right
Yeah.
to be motivated. Um, and I think a lot of the work as a physician too is not only work like understanding and learning protocols, but also figuring out how to make teams work together, because
Mm.
physicians don't work in silos, right? There's a
Mhm.
whole team
Care
that goes
team. Yeah.
into patient
Yes.
care. Exactly. And then, I set up my own private practice, learned a lot of the basics around
Ah,
business, which is you have to be making more money than you're spending, right? At a very basic
money
level.
in, money out.
Right. And what are the levers that you need to pull, and how do you develop that resilience to, keep pulling and pushing levers and trying things when things aren't working, and to kind of keep going. So
Mm.
I would say that those are all the ways that being a physician really helped me. And I think too, it's a little bit of what you bring to it. I went to medical school when I was 20 years old. I skipped a year of college because I was just so excited to get in
Wow.
there and like start seeing patients.
Yeah.
I graduated from the anatomy lab before my 21st birthday. And so they brought like beer to the post-anatomy
You're like,
party.
I can't drink it.
Yeah. And the admission, my med school was like, but you can't drink it because we can't be responsible for underage drinking that happens here. Um, but it was, I think it was like a lot of that excitement that I think a lot of physicians do bring, at least to training, before
Sure.
sometimes life and practice change things along the way, which is the same like energy that I was bringing to this problem that I was seeing over and over again, which is like this
Yeah.
excitement about getting in there and doing something.
Mm.
The ways in which I think it was difficult is I think as a physician, you are programmed to look for pathology, right? You're
Right.
always looking for what's wrong.
Right.
And so you get
Get to the
really
root of the problem. Yeah. Yep.
it's the root of the problem. But as a result, you get very focused on risk and you get very focused on the things that are wrong. And I think to be an entrepreneur and to enjoy the entrepreneurial journey, you can't just be focused on risk and you can't just be focused on problems and barriers. And so I think that there was a lot of, moving away from some of that physician mindset that I had learned, been trained, had been steeped in to take a jump off this entrepreneurial cliff, which is like, I don't know exactly what's going to
Yeah.
happen. I don't know, all the different problems that are going to come up. I can see that these are going to be the major challenges, but, who knows what's down the line here. And it's scary and risky, and we're going to do it anyway.
Right.
So I think that was probably, some of the challenge. And even, so we went to Y Combinator, got into that tech accelerator, and a lot of the
Oh,
learnings.
congratulations. That's a hard accelerator to get into. Yeah. Yeah.
Thank you.
Yeah.
A lot of the learnings there was to work with people who were working on healthcare who didn't have the same training. And, whereas I might have been a little bit more tempted to sit and ideate on things until they were perfect in my brain before doing. I was seeing people who were iterating and ideating and putting things into motion, not over the span of months, but over the span of days. And it really kind of helped push this, let's just get out there and do it and figure it out along the way, as opposed to being overly perfectionistic about what we're trying to accomplish here.
I find it very interesting because to what you said earlier about physicians and the root of the problem, like, so you're testing as a physician diagnostically to understand, what is happening with my patient. As an entrepreneur, you're testing to understand, do I have product market fit? Are my stakeholders going to use this? But at the same time, you're still removing a problem for them, right? Ultimately. So there's a lot of parallels there, I'm sure. It's very exciting. When you think a little bit about your own personal beliefs as a physician and how you feel about healthcare, Sipra, you kind of talked a little bit about this in the beginning, but I know that LunaJoy has a very strong mission. And I'm curious to how those kind of shaped together, how much of your own beliefs about healthcare kind of shaped LunaJoy's mission, how much LunaJoy's mission is starting to maybe reshape the way that you're approaching your beliefs about healthcare. Can you enlighten us a little bit about that?
Yeah, those are great questions. I think almost a decade into practice, a lot of the ideas that I had about healthcare when I was a really excited medical student, motivated to skip a year of undergrad to get there.
The world.
Very, very much shifted, and very much shifted from like, this is the idealistic, this is what we do with patients, this is how, we're good humans and we deliver service, to there is a whole healthcare world that is not optimized around patient outcomes. It's not optimized around patient safety. And quite frankly, in psychiatry, it's not optimized around preventative care, even though that is the primary care model, and primary care,
But only very recently too, right? I mean, the preventative model for primary care is a relatively new thing as well.
Right, where, one primary care visit with most insurance is covered a year because they recognize that in paying for that, they're going to save costs and it's good for people, right? But that hasn't come to mental health care yet at all. The care that we have is all reactive, it's crisis-based, it's not proactive, it's not preventative for sure. And so I think seeing a lot of frustration or seeing things that were very frustrating over the course of, that many years, and thinking about, well, not only how do I bring change as like an idealistic person, but how do I bring change in a really antiquated system? Like our payer system is very antiquated. Our health systems run on really antiquated models. I mean, we still fax referrals. Like, it's bizarre, right?
Yeah.
80% of the referrals.
Well, not to mention all the backbone of healthcare on their claim systems are antiquated systems.
Exactly. And so, I'll be honest, a lot of frustration, but I think like turning that frustration into like energy to change something was important. And then the other, how do we do something that is radical and disruptive, but do it within the confines of what the system looks like, and figure out how to incentivize people to do the things, because nothing in healthcare.
Because you do eventually, at some point, you have to work within you can't completely disrupt. Well, you want to disrupt your sector, but you still have to play nice.
Yes.
I guess, right? Yeah.
And so it was a lot of just coming to terms with like, I know what's right by the patient. How do I translate that
Yeah.
into incentives for all the stakeholders that
Mhm.
are involved? And it is a very different language for each of those stakeholders. So there was a
Yeah.
lot of that, like, goal, mission, translation. Okay, boom to this person, boom to that person, boom to this person. And I'm like, this is how I have to bring the ecosystem together, which is
Right.
a whole mental, you know, a whole mental
A
thing.
whole mental exercise. Yeah. So much of what you said there is again completely resonates with, folks having to kind of take their own responsibility for their mental health
Yeah.
at a level that isn't necessarily seen in other aspects of medicine,
Yeah.
right? And not having a primary care model of mental health,
Right.
right? Think of, folks. I'm sure folks can resonate to their own mental health journeys and saying like, wow, I had to do the legwork to find a therapist,
Yeah.
to understand if that was going to be paid for or not,
Yeah.
right? So much there, and the coordination doesn't exist, right?
Right. And just
Yeah.
looking at a lot of the inequity that still exists
Oh,
between
sure.
mental health and
Absolutely.
physical health. With every pregnancy, I had a glucose tolerance test.
Hmm.
Every time I had a glucose tolerance test, well, with my twins, it was abnormal. There was a reflex automation that called me in to do, the 3-hour glucose tolerance test.
Right.
And in no
Right.
world would we ask women to do a test to get results that are abnormal and then just to like
Yeah.
leave it on the electronic medical
Leave it on
record
the
without
table. Yeah.
any follow-up and to
Right.
think that was okay care. And that's what we do in mental health all the time.
Yeah, absolutely. Yeah, you would never, if you had an early indication for gestational diabetes, you wouldn't just ignore it.
Right. You're gonna be like, that's nice. That number looks high. Well, I'm gonna go
Well,
about my day now.
yeah, or Cipra, you're going to have to try to figure that out on your own, right? So,
Hope you sort it out.
a few months back, we had the extraordinary pleasure of having Professor Rita Colwell on the show. She was the first female director of the National Science Foundation,
Great.
and a huge accomplishment, right? In so many ways. And I think at the time we interviewed her, she was 87 or 88 years old. She's a little older now.
Mhm.
And I was asking her about, her community
Mhm.
and who are the members of her community.
Mhm.
And I hope she listens to the show now, because I hope she realizes how much I quote her. But she said, "Oh, you mean my posse?" And that was
Love
I was delighted by what she said. Right. So,
it.
Sipra, I want to know who's in your posse.
Yeah. A huge part of this journey has been developing the posse.
Mm.
And I would say that there's certainly like friends and family that are in the posse, but a lot of it has been developing a set of like friends, mentors who have done things like
Yeah.
started their
Been
own
there, done that
businesses.
things. Yeah. Yeah.
They've done things that are bigger than things that I'm doing, and
Mhm.
have been like wonderful enough to give me time, mentorship, direction, and sometimes even just like a pep talk, or
Yeah. When you need
sometimes
it.
the
Yeah.
opposite of a pep talk, which is like, get out of your own way, get out of your own head. Like,
Get out of
why,
your own
why
head. Yeah.
right? Why are you still focused on this like small setback that you had 5 hours ago? Like, let's move
Right.
on,
Move on.
right?
Yeah.
Um, and so developing that, I think, has been a really intentional thing over the
Mm.
last number of years, because I think who I was automatically surrounded by, and we're surrounded by a set of people based upon like who we are, where we
Yeah.
work, what we
Our
do,
own values. Yeah.
our own
Absolutely. Yeah.
values.
Yeah.
And certainly coming out of residency and being a practicing physician for a long time, I was really surrounded by people who were seeing patients day in and day out,
Mhm.
who didn't necessarily have the appetite for driving or motivating a lot of change, and
Change.
quite
Yeah.
honestly who were pretty risk averse, right? And so you pick up thoughts and feelings of the people around you. And so for a long time I used to be like, well, I'm risk averse.
I'm risk averse, and yeah,
I'm
I don't want to disrupt. Yeah,
I don't want
absolutely.
to
Yeah,
disrupt.
yeah.
And then there's this like period of time where you have to tap into who you authentically are, regardless
Mhm.
of whatever circumstances you've been,
Find
and
yourself in. Yep.
find other people.
Mm.
Right. Find other people who like actually help support who you authentically are. And I think
Right.
authentically, I am a risk taker. I am a disruptor. I am an innovator. If I wasn't doing this, I would be building something else. Uh, and you find the people who also gravitate towards that, and you can
Right.
kind of look at their path and learn and kind of be around it to help foster.
when I go back to what you said earlier too about you started your own practice. So in a sense, you know, that's very entrepreneurial, small business owner yourself. Were some of those people that were in your sphere at that time saying, Sipra, don't do that. Go work for an established practice. Go find, yeah, absolutely. Huh? Yeah.
And I almost did that. I think this was like a pivotal moment for me to really figure out how am I going to start the next decade of my life, because I was coming out of residency. I had these two twins at home that didn't sleep. They were super colicky. Like one or the other was waking me up all night long, right? So I had very little like mental and emotional bandwidth. And I was the first in my residency class to apply to jobs. I was very on top of it. I got an offer from a big health system, and I was like, great, safety,
Great, perfect.
security.
Yes, everything I need, right? I'll just work
My
for the health
sign-on
system.
bonus,
We'll take care of everything. Yep.
more than I'd made the entire year as a resident, right? So I
Right.
was just like, I'm set. And a couple of weeks before I was supposed to start that job, like my call schedule changed, and a number of things had changed.
They
And
start pulling the rug out a little bit.
yeah, there was a little bit of pulling that rug.
Yeah.
And I had been thinking about private practice, and a lot of, especially in academia, right? Because you can never know as much as you ever really need to know in academia. So a lot of the feedback that I was getting is like, no, you should go work for an establishment for a couple of years, then think about doing your own private practice. And you don't really have the skill set. You don't really have the knowledge base. But if you take a second and think about how ridiculous that was, I was like, I've been in school for 8 years, and 4 years of residency after that. Like, if I don't know as much as I'm going to need to know now and can't just like fail my way to figuring it out, I don't know.
Yeah. Right.
And the week before I was supposed to start that job, I sent back my sign-on bonus and
Wow.
told them, like, I'm not coming
Yeah.
because this is not the job that you had given me originally. And I know once I start, there's a very extensive non-compete, and I'm not going to be able to do or to
wiggle
build
my way out of that. Yeah. Yep.
Yeah. And so here I was, these two babies that, like, literally between diapers and formula and childcare, like, I was way overspending my resident salary, and I'm sending back this huge sign-on bonus and this huge salary that I'm about to take on.
Yeah.
And so it was a really defining moment for me where I was like, well, what do I do? Am I going to go cry?
I was just going to say that. What am I doing? Yeah. What do I do? What's my next move here?
And what I did is I found, I reached back out to old mentors that I had developed over residency. A number of them were in private practice. And I said, I need between 15 and 20 minutes of your time. I know you're very busy. Yep. Everyone's super booked up. I will come on a Saturday afternoon, Saturday morning, Tuesday, at 9 p.m., whatever you need. I need 15 or 20 minutes of your time. Yep. And I have questions that I need to go through. I took my little notebook. I did a round of probably 15 of these mentors who gave me all of the skinny on what they did, what they shouldn't do, what they didn't do, all the mistakes, whatever. And within 2 weeks, I hung my own shingle. I had a private practice. I rented really part-time. I borrowed space from a fellow. I was walking down a hallway, and I saw Jonathan Levy, and I was like, I think I know his name from residency. I think he was a fellow a couple of years ahead of me. Sure. So I just opened the door to his office, and he happened to be there. And he was like, oh, I don't use my office Tuesdays and Thursdays. I'm like in the other clinic. And he was like,
I know somebody who can.
I was like, hi. And he gave me a month or two free, but within 2 weeks, I had a private practice, incorporated, up, running, had printed business cards. And within 3 or 4 months, I was profitable in that private practice.
That's amazing. I love how tactile you are. I love it. Yeah. But strategic at the same time, right? Yeah. I mean, you're you're getting the what done, but at the same time, you're being very strategic about it. That's so cool. Yeah. And kudos to you too for having the just the courage to go and knock on John's door and be like, hey, what are you doing? Hi.
Do you remember me from 4 years ago?
Remember me? Right. From 4 years ago. Yeah. Absolutely. Amazing. Mm-hmm. We are talking with Dr. Sipra Laddha from LunaJoy. HelloLunaJoy.com is the website, right? So Sipra, this is a long process, a journey, right, of building LunaJoy. Right. What has been the most favorite part for you up to this point?
The most favorite part, two most favorite parts. I'll do them quickly. The absolute most favorite part is the impact, right? When I read patients writing back that they were lost, they needed the service, they were so happy that they found us, they feel so much better now, they're thriving with their baby, that they're, not feeling like they made a huge mistake by becoming a mom just because they had some support. Sure. That is absolutely my favorite part. That's always been my favorite part of medicine. When I was in private practice, I could, see 8 to 15 patients a day, and now we're literally able to deliver that to thousands of patients, a month, and so that is my favorite part. The second favorite part has just been working with my team, developing my team, like,
Mhm.
learning about people, bringing them on board, getting us all to see the same mission, vision, like, understanding what working at the company is even doing for their families. And it's been amazing
It
to
is
kind of
amazing.
expand um, just the people that I'm
There's
around. And
nothing like building a team that
yeah,
you are tremendously excited about, right?
yes.
Yeah, it's a great feeling for sure. I am also curious, Sipra, about what LunaJoy is doing to battle, kind of the severe inequities we see, not just
Mhm.
in postpartum mental health, but in sort of, prepartum, antepartum,
Yep.
there's so much inequity there. I'd love to hear sort of your thoughts and approach on sort of, removing some of that inequity, maybe only from a mental health perspective, but I have to imagine you're thinking about it holistically as well.
Yeah. I like that you brought this up. I just came back. I was a delegate at the UN for a health equity meeting yesterday, and so this is something that we're always thinking about at LunaJoy, but certainly, I think is finally a focus even for payers and other people in the ecosystem. So what we're doing at LunaJoy is we are taking Medicaid. We are, doing sliding scale. We are really breaking down the barriers that are in place right now for women to get into care, and figuring out how to make those unit economics work on the back end so it's a sustainable model, but at the same time that we are delivering care to A, the people that need it the most, and B, not only the care, because there's so many things that happen before care. There's engagement, there's
Right.
education, there
Right.
is trust that needs to be built. There are social determinants of health that not only need addressing, but like even we just need to understand what those are before we can actually be delivering mental health services. And so
Right.
we have put a lot of time, attention, collaboration with places like CareSource Georgia or Sunshine
Mhm.
Health in Florida
Mhm.
to understand their members better, who have typically significantly worse outcomes, than their white female counterparts, and also to work with them very closely so that even though the care is ultimately, what we do as a company, that we are able to build trust, build connection, understand their needs, and give that information back to the other stakeholders who are interacting with them.
I worked with Sunshine for a while in a previous career. I'm very familiar with
Mhm.
Sunshine and some of the other Medicaid plans that you mentioned. Are you national at this point, Sipra, or are you still working your way to national coverage?
Yeah, so we're working our way to national coverage, and I will say I don't think that national coverage is actually a goal right now at this
Oh, okay.
point.
Okay.
Our goal has really been to serve the states that we're in and to go much deeper into the states that we're in. Healthcare, there's a lot of like just credentialing and licensing and all of that that goes into every new state that we go into. And so we've taken the approach as opposed to being spread everywhere to go deep in the communities and the states that we're already in. So we're actively practicing in 11 states. We might be adding two more on this quarter, but
Very
it's
exciting.
really
Yeah.
been to try to get market share, really develop a presence in those places.
Now that's very exciting. And I appreciate what you
Mhm.
said there about the goal may not be to be a national
Mhm.
provider, right? There are so many inequities across the states that you can attack almost in a one by one sort of
Right.
approach, right?
Mhm.
Yeah, that's very exciting. As you think a little bit about kind of the evolution now going forward of LunaJoy, you talked a little bit about we're in 11 states, we might go to two more. Not
Mhm.
so much state expansion,
Yeah.
Sipra, but just as much as you feel you can speak about it, what do
Mhm.
you see, sort of some of the natural evolution of what you're doing from a services perspective?
Mhm. Yeah, so I think, one of our strengths is that we have been very, very focused on delivering excellent mental health care. And I think, especially in this population, it's a little bit of like the shiny object syndrome where every once in a while I'm
Oh
like,
yeah.
"Well, what about breastfeeding? What about pelvic floor physical therapy? What about all of these other needs that pregnant and postpartum women have and they need, and even perimenopausal women?" And there's so many different things that we can do. And then I kind of come back to our core, which is, this is my opinion. Um, when mental health is done kind of as a side of anything, it is not done well. We see this in our health systems all the time, right? We have like a thriving cardiology unit and a burn unit and all these other things. And then there's like a little side of mental health that's stuck somewhere, typically on the 13th floor. That's where it is, one of the hospitals that I trained at. And when there's no like emphasis given to it, it's just a little bit of a side. It's not done well. We're not doing evidence-based treatment. We're not driving outcomes. And so I think that there's so much to do in the space. And then I always get back to, if we can deliver excellent mental health care that is personalized and specialized for women, whether they're pregnant, postpartum, whether they're perimenopausal, if we can do that and we can do it really, really well, then we would have accomplished our job as a company.
First things first, right? Yeah.
First things first. And so like our next kind of the thing that we're driving towards is just getting deeper payer relationships. So when they are treating their member population, right, we are able to integrate directly into them, and that we are getting patients into care much faster because it's coming directly from the payer.
You're removing the barrier of payment, right?
Exactly.
Yeah.
And then to drive deeper, like OBGYN and health system relationships. So at the moment that the woman is screening positive, or we have some indication that she is struggling, like at that exact moment, information is sent over, and within like 5 to 10 minutes, there's an outreach and there's some kind of connection to mental health care. That's where we're striving.
I appreciate that, because I'm sure there is a temptation, right, to really continue to think about like, well, as we move across, even the women's health vertical is very expansive, right? And you could say, well, we're going to add on this and add on this and add on this and add on this. I feel really confident in the fact that you guys are like, let's do the best that we can do as it pertains to providing the most excellent mental health care that we can provide, right? Yeah. And of course, removing barriers of payment, which is so important. And I appreciate, again, too, coming from a payer world myself, the integration with the payers and making sure that the payers, of course, see the value in what you're providing, right? And then pull it into their own medical management, right? So that's
exactly. And also pushing these things that we know to be true into the business model of what the payers are doing, which is that they have behavioral health benefits and then they have physical health benefits. And it's so wild to me, right? Because especially in the
and then never the twain shall meet, right?
Right. And especially in the pregnant postpartum population, it's like one of the few places that we can immediately see the physical outcomes on women who don't have good behavioral health intervention, right? When we look at that cohort of women, their babies are delivered earlier, there's higher NICU stays, there's higher like intrauterine growth restriction, higher rates of complications. Exactly. And I think PMADS, perinatal mood anxiety disorders, is like the gift that keeps on giving. We think about it as just like, 3 months or 6 months or 9 months. But what it essentially is a lifetime, if not treated, of more difficulty and increased struggle. And so a lot of what we're doing with payers, and this is like the non-sexy stuff, is really like, let's look at these outcomes together. When we are aggressive about our mental health interventions during pregnancy and postpartum, sure, we'll save costs in the traditional ways of less ER visits and things like that. But are we having healthier babies?
Yeah.
Are babies coming out at 38 weeks as opposed to 36 and 35 and 34? Is there less preeclampsia? Is there less gestational diabetes? Those are things that can be measured, because it is really bringing the mental health into the physical health. And even though there's a lot of resistance to this on their part, when they can put those things together and they see those outcomes directly affecting each other, this is how we really can drive forward.
I appreciate too that you're thinking of these like almost counterintuitively, right? Like you said, like it's easy to look at things like, did ER visits go down, right? Sure. But there could be lots of factors for that. I like how you're thinking about the counterintuitive of like even like you said, just like birth weight or or actual
C-section rate.
Yeah, absolutely. Yeah, gestation rate. That's really exciting. Sipra, you probably get this question a lot, but what's when you think about when you first started this entrepreneurial journey, both as a private practitioner and as a co-founder of LunaJoy, what did you wish you knew, right? What piece of advice did you wish you had, or could have been given to you, could have given to yourself when you first kind of kicked off, looking back?
That is a really good question. And I think I got some of this advice, but maybe I wasn't hearing it at the time. But I think like the idea of showing up as who you authentically are is really important. And I think especially as female entrepreneurs and a female entrepreneur that has now raised venture capital in a world where many female
Really hard
entrepreneurs
to do that. Yeah. Yeah. I mean, the
do raise
numbers are
venture
not in your favor in terms
capital
of
in our favor.
women founders and VC. Yeah.
Yeah, I think that there's often a lot of energy that goes into like presenting or being a way that you think you need to be in order to get buy-in or raise capital. And I think the advice that I would give is just to be more unapologetically whoever you are,
Yeah.
and to recognize, I think these things are sometimes disconnected, is to recognize entrepreneurship is really, really, really hard. Like, I
Yeah.
think it is, you know, the last 3 years of my life have probably been the most difficult 3 years of my entire life, including the year that I had twins during residency. Um, but that just because something is really, really hard, and just because something might not really feel good a lot of the time, because a lot of the entrepreneurial journey is hearing no, 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 no. And when you hear a yes, it's nice, but that yes feels 5 seconds long and the no feels 5 hours long. But you know, it's not all sunshines and roses. But if you stick with it, there is so much personal growth and professional growth that can happen as well. So
Mm.
just because it doesn't always feel good, just because it's not easy, just because you're not getting it the way that you want it in the time that you want it, does
Right.
not mean you
Doesn't
should stop.
Right. Right. Don't give up just because the timing doesn't feel right. Right.
Yes.
Yeah. That's
Yeah.
amazing. Sipra, thank you so much for taking some time out of what I can only imagine is an extraordinarily busy schedule. You're moving between coasts and everything else. Thank you for being here, Dr. Sipra Laddha from LunaJoy. Hello, LunaJoy.com. Once again, we really appreciate your time, and best of luck to you, your co-founder, and everything that you guys are doing for this really, really important mission that you have.
Really appreciate your time, Richard. Thanks for having me.
You're welcome.